and joining us. I think when the presentation is over, you're going to probably thank us for inviting you because we have some information that's going to be very informative. It's going to be not just informative, but it's accurate and it's beneficial. Um, the reason I'm having this meeting, these are products that I've been taking for the last 8 years. And optimizing the immune system is so important because most of us, our immune system is compromised and it needs to be optimized. So we're going to listen this evening as to how we can do that. And so I won't take a lot of time, but I will let you know that my family and I have benefited greatly from these products. Um, right now, most of my family members are taking the nutrients, the micronutrients. And one case in point that I really appreciated that micronutrient protected my husband and myself was when we had COVID-19. And we were able to fight it with the micronutrients, uh, optimizing that immune system, kept us out of the doctor's office and away from the pharmaceutical drugs as well. But there are many, many other benefits, even for children, as babies can take our products. They're very safe. And so this evening we're going to have the director and CEO of the Healthcare Support Association coming to us, Jonathan Jones. Um, and like he's going to tell you, he's not a doctor, but he is a researcher. He does deep research. If Jonathan presents something to you, you can trust it because he's taking it, his wife is taking it, his mother-in-law is taking it. Anytime a man can give something to his mother-in-law, you know it's a good product. So just sit back, listen. If you have any questions, he'll open it up for questions as well. But he will give you a lot of information that's going to be beneficial. So I thank you all, and I'm going to turn it over to Jonathan Jones.
Delores, thank you. Thank you very much. And I have to just, commend you for your determination. It takes a lot of, it takes a big heart to care about people. And so for as long as I've known you, you've cared about people and you haven't been afraid to just put your reputation out there on the line and tell people when something is good. You've been willing to do that. So it's been a real privilege to have known you all these years. So thank you very much for setting this up.
Thank you.
And for those of you who are here, you were invited by Delores or someone else who cared a lot about you. I commend you for taking time out of your busy schedule to attend a presentation like this. As Delores mentioned, I'm not a doctor, so don't do anything I say because I say it. I'm a researcher, and I was determined to try to find solutions to my wife's health problems. At the time, we were initially, we just set out not to get the diabetes that my mom had and her father had. We just didn't want that. But as it turns out, my wife had severe allergies. And so she was allergic to everything under the sun. And but that led me down the road. Well, it led us both down the path of trying to find a solution. Because, if you have severe allergies, I'm talking about everything, the air, she was allergic. She was allergic to me. Anything she ate, she was allergic to. It didn't matter. It was all having a hard negative effect on her. You couldn't, enjoy being around people. She couldn't enjoy just going to dinner. She couldn't enjoy having people over. Life was controlled by these allergies because no matter what she did, she was reacting to everything. Well, it took a lot of searching, but we eventually found the root cause of the problem. Turns out my wife had leaky gut syndrome. And so once we got to the core problem, then we were able to then take steps to make her immune system strong and robust. And that's eventually where we found these products that I'm going to tell you about today, Micro Daily. Because out of all the things that we found that was beneficial, many of them very expensive. We spent tens of thousands of dollars going to specialist after specialist with boxes of holistic medicines from all these different practitioners. You take 10 drops of this, 2 drops of that, 4 of these pills, rub this on your navel, stick this on your belly, put this on your foot, soak your feet in that. It was a huge number of just everything, you can name it. But now the one simple thing centers around these formulas that we'll tell you a little bit about today. We're not going to go into a whole lot of detail, about how microdaily works, the science behind it. We're not going to go into a lot of all that. We're just going to share a couple of testimonials with you. And the testimonials will help you to appreciate that something unusual had to have taken place. This coming Sunday now, if you want to hear a lot of the science, make sure you're here Sunday at 5 o'clock, because I'll be interviewing Dr. Prasad about stroke. This month is National Stroke Awareness Month. And so that's what we'll be talking about. So we'll be sharing some specific testimonials on that as well. But tonight's meeting is a little bit more informal. I still have to give you the disclaimer. So the FDA has not evaluated these comments, and we're not making any claims that these products will treat, cure, or heal in any way, shape, or form. This is for information and educational purposes only. We strongly recommend that you seek the competent medical advice of professionals that you trust. And even when you hear testimonials, please understand that they're purely anecdotal. What happens to one person may or may not happen to you. So by law, we have to tell you that so that we don't mislead you and make you believe that a natural supplement can heal or cure a disease. Only the government can declare a nutritional supplement to be a treatment or cure for a disease state. Okay, so just briefly, as long as this is more of an informal discussion, and by informal that means you could raise your hand. You have a license now to just say, okay, I need to know about such and such. So if there's a particular issue, some particular subject that you prefer to hear something about, fine, that's good. Heart disease, high blood pressure, arthritis, diabetes, whatever the case may be, you're more than welcome to put it in the chat if you want. If you prefer to just send it directly, you can put that in the chat and say what it is that you are specifically concerned about. And I'll try to maybe even find a testimonial along that line that could help you. But there is one testimonial that I'd like to share that I think, in my opinion, illustrates how unusual these products are, and I think that I can share this one because the person who this situation, the one telling this story, is actually right here on this meeting tonight, so she can fill in some of the gaps, and she can tell us, whether she was embellishing this, or you can even ask her yourself if what she just spilled her guts about in this in the recording that you're about to hear, whether it was true or not. So I think you'll appreciate this one. All right. So because as she says in her own story, she had all kinds of problems, and her doctor wanted her to be taking I think she said 99 pills a week, and so she was determined she was not going to be taking no 99 pills a week for nobody under no circumstance. So let's listen to Roberta Rice's story.
She sent. This is her knee with the saran wrapped.
It's all wrapped with microdaily.
Yeah, and then that's what it looked like when she put the ACE bandage around.
Okay.
So that's gosh, she didn't send me the after picture though.
Right.
But anyway,
that's part of the story.
I just said I want proof that you did this.
Yeah. Very good.
Here it is. This is the next one. It's pretty incredible.
In April, I had lost the ability to walk. Out of the clear blue, never happened to me before. My leg had swollen, and my right knee was 3 times the size of my left knee. And then Brother Jeff asked me, I got on Dr. Kekola Roberts connected me with him, and he gave me a little remedy to do. He said, take Dr. Prasad, the side capsules and open them and mix them with organic coconut oil and make like a paste. So I opened all those capsules. I mixed it with the organic coconut oil. I rubbed it on my knee like Brother Jeff told me to do. I wrapped it in syringe wrap. Then I wrapped it in the first aid bandage wrap, and I went to bed. The next morning, I was able to get up and put my leg on the floor, which I had not did for April and May I had not been able to do that. And then after 3 days, I was hopping on my leg. I was able to put pressure and hop on it. In less than a week, I was walking completely, no pain, no nothing. To the young lady, Linda Ross, I had dizziness. I was extremely ill with autoimmune disease. I used to be on 99 pills a week. And then the company ran out of what I was taking for 3 months. God allowed Dr. Piccola to call me, said she'd been thinking about me, and I started to get choked up and cry. She said, "How are you doing?" I said, "I'm very sick," and I just started to dump on her about my health. And yes, I felt dizzy. I kept taking it like she told me. Yes, I had loss of balance. I kept taking it like I was told. And so long story short, I wrapped my knee, and in a week, I was able to walk. 3 weeks later, my husband and I started going to the park, putting in 2 miles 3 to 4 times a week. No problems with my legs since. And if I had to, and have an autoimmune, the doctor says I would be on medication for the rest of my life. Like 99 pills, are you serious? I don't think so. So if I had to be on this for the rest of my life, my health is my wealth. And whatever I got to do, I'm going to do it, because a lot of times we wait until we get sick unto death. Because my husband and I was planning my funeral, and we wait till we get sick unto death. Then we want to try and hurry and take everything that we can take to help us. And so I'm doing good, no pain on my body. I used to have pain from head to toe, 24/7, no pain on my leg, no pain in my knee. Now both of my legs and knees are the same size. I'm so grateful for that. One last thing. The doctor told me when I come back that they were going to put me on diabetes medicine. My diabetic number was 6.8. And so she thought when I came back, I had my physical, and she said, "What are you doing?" And I said, "What do you mean?" She said, "Your blood pressure is down from 150 over 90, over 120 over 70. My A1C went from 6.8 down to 5.4. Hello. And no cholesterol medicine. None of that, Dr. Prasad. I am so grateful. And the knee injection I was supposed to take, I called the doctor's office, canceled all of that. And all because of this and this.
Yeah. That's it.
Collagen. All because of that. Those right there. And I have everything else now. I'm in great and excellent health. No diabetes medication or injections. Thank you.
Absolutely. And in fact, in this next one,
Let's just pause here for a second. You just got an earful of Miss Roberta Rice sharing her story, and I think Roberta is still here on the meeting right now. Roberta, are you still here right now? No, okay. Roberta was here earlier today. We had a meeting earlier at 6 o'clock, and so she was on that meeting. But did you notice that a couple of things she said there, 99 pills a week that she was taking? She said she had balance issues also. And this has made all the difference in the world. This is, testimonies are purely anecdotal. So what happens to one person may or may not happen to you. But she said something that I think I heard for the first time, this time I've heard this story, that I wanted to ask her about. She said she and her husband were planning her funeral. And I hadn't paid attention to that before. So that really kind of tells you just how bad her situation was. So, and how hopeless she felt. and she was taking everything that she was being told to take by the medical professionals. But it was Dr. Prasad and his formulas that made all the difference in the world in her case. So I'm just going to briefly just tell you a little bit of the story behind these products that she was taking, and why it's possible that something like that could have an impact on a person. This brochure, by the way, you're able to get this. Just whoever invited you to this discussion, they can send you this electronically. And it tells the entire story, gives you all the science behind each of the products. We're not going to talk a lot about the science. I'm going to tell you a little bit right now of the origin of the product and a little bit about the scientists that formulated the products, and then maybe share one more testimonial with you before we take some of your questions. But this is the most scientifically validated micronutrient in the world, no question about it. And the real reason why we're sick is because of all the toxins that we're exposed to. So you may have heard that. They may even sound like a broken record to you, but it is a scientific proven fact that that's what we're dealing with is toxins. And for the most part, if we had the right nutrients in our food, we wouldn't need any kind of a supplement. But these supplements that Dr. Prasad has put together really amounts to the food that's missing from our food. So that's the one thing is you can just kind of remember that. Then you get the right idea as to what these products are. But Dr. Prasad was answering a call from the United States government. They wanted a product that would keep the soldiers on the battlefield in optimal health. And so he stepped up and said, I can take care of that. I can put together a formula that will do that. And none of the other vitamin companies, none of the other major companies in the country stepped up to want that contract, that assignment. But Dr. Prasad said, I can do it. And the government ponied up millions of dollars to back his research and putting together this particular formula. So, and why they would do that is because of the credentials that this man has. So he's been published more than 250 times. I've heard from other doctors and scientists that if you get published one time in your life, your career has been worth something. But this man has been published more than 250 times, and he's still writing science papers to this day, and that are papers that are being published. He's still authoring books that are still being published to this day, and he's 90 years old. So he was the world's first radiation biology PhD. So we're not talking about someone who just came out of college and learned how to formulate products. No, he was the professor at the University of Colorado School of Medicine for some 30 years. So he was Professor Prasad. He taught doctors. And then he ended up in a situation where he said, there's something missing. He had an opportunity to work in conjunction with the government and with NASA to put together a unique formula, something that he clearly had the credentials to be able to do, and he did it. And that's why we have this product. So the government required all kinds of things, safety testing. This goes back to 2004, as you can see. And so the Department of Defense is where it all started. A lot of animal studies were done. Safety tests were all completed. Human clinical trials were completed in 2005. Microdaily became available to the rest of us in 2006. And I didn't hear about it until some years later. In fact, it was Jeff Ashby that introduced it to me. And I sent Jeff to go to speak to Delores in Albany, Georgia. And that was, what year was that, Delores? Was that 2016 or so? So I think it was 2016.
Somewhere around that time, maybe 2016, 17. I know we had a tornado or either a hurricane in this area when Jeff was coming through.
Okay.
Yeah.
So we're talking somewhere around 8 or 9 years ago is when we first heard about this. And it's still relatively obscure now. Almost no one knows about this. And it's the best kept secret in the world, if you ask me, which is really a shame. So we need help getting the word out, because 2 little pills can make a huge difference in someone's life. And that's what we're finding out. We're finding out that Dr. Prasad's formula is making all the difference in the world. So you can see here, there's one paragraph that we highlighted that this product was formulated not just to protect, but to sustain the troops on the battlefield. That's what they did. So Dr. Prasad, expert, world's foremost expert on micronutrients and supplementation, he was the one who developed the supplement that could provide a singular daily source of nutritional defense and nourishment for the U.S. troops. It was designed to keep them in optimal health. One of the patents has the words optimal health in the title itself. I'll show you the list of patents that this original formula was given back when it was first contracted to be produced. That's what the package looked like right there. And it would fit in the side of those armored fatigues you see on that soldier there. So that's where it would fit right in there. So it would fold in half, and they could punch out their 2 pills in the morning. And then on the right side, you see they punch out their 2 pills for the evening. And that's how they would take it. And Dr. Prasad is the brain behind it. That's him on the left. And but he didn't have a whole lot of money because for some reason the government decided that they were not going to continue with that product. As phenomenal as it proved to be, they dropped the contract, just like many other good things that that our government will do. They change their mind and then go in a different direction. In fact, as I'm told, there was a clinical trial that was taking place at Walter Reed Medical Center. And all of those in the control group that were taking the micronutrients were getting phenomenal results. It was all about diabetes. And then apparently word must have leaked out somewhere that that's what was taking place and that it was not a pharmaceutical drug that was being tested. So the entire management team of that trial was replaced. And then the study just halted. And all the results just buried. Millions of dollars just shut it down. That's the way it works. Just shut it down. But you couldn't stop Dr. Prasad's knowledge of the product. He knew what he did on the left. And all he needed was someone like a David Nemelka to produce what we see on the right. So the brain met the brawn. And that's where the company Engage Global was born. And now we have access to that same formula, but in that bottle right there. And it is amazing. That's what I can tell you. Some people don't like taking capsules, so Dr. Prasad put it in powder packets. The original formula is right there in the yellow box. So you just tear open a packet, put it in a bottle of water, and you can drink it down. Tastes a little bit like lemonade, so I kind of like that also. It's really a great way to get the product. But that's the beginning of it right there. Those are those 2 bottles where it all started. These are the ingredients. And again, I'm not going to get into the science, but understand something. Even though these ingredients don't look special, they are very special because of who put them together. I don't know about you, but if someone were to ask me exactly how much of a particular vitamin is the optimal amount that I should take, I wouldn't have the answer for that question. I know some because I've been doing research for a long time. So I do know a little, but I would not be able to sit down and say that this particular combination of products in this particular quantities is the optimal thing for good health. I would not be able to do that. And that's not a news flash because I'm just not qualified for that kind of thing. But there are a lot of people who are not qualified for that. But Dr. Prasad is. And that's what we have here. And so what we have in that bottle is his brilliance and his decades of training and intelligence that put together this formula that is exactly right for what we need. This is the most advanced formula here. The EMF, he added 4 more ingredients because we're all being bombarded with 5G radiation. So Dr. Prasad said we need a little bit more. So he put a little bit more into the bottles. And that's the reason why we have the micro daily EMF formulas. So the capsules on the top and the powder packets on the bottom. And again, it tastes a little bit like lemonade. It's amazing that it tastes as good as it does. So you can count on that not being difficult at all. This is the methylated formula. It's a little bit in between the two. It's halfway between the original formula and the EMF. That's what this is. So the body's able to absorb the methylated Bs a lot better, which is in fact good for the central nervous system. So if a person's having central nervous problems, they may not be assimilating B12 and B9 properly. So this is a very good way to step that up. And it's a very rare person that has a problem with the gene MTHFR, and that's the one that solves that. So there you have it. That's it in a nutshell. This formula here was for children. This is the GLP-1 weight loss product, which, by the way, now, if you're looking to lose a little bit of weight, this is the way to go. because this behaves in the body just like Ozempic, but without the side effects. So it's a natural GLP-1 booster, GLP-1 promoter, GIP promoter as well. So two hormones that are important in metabolism. So this sends a signal to your brain that you've had enough food earlier in the eating process. And so I've been finding that to be the case, that if I'm eating, I find that I'm only eating about half of what I ordinarily would, because, if I keep pushing it, I'm stuffed. Today, for example, I went out and had no breakfast. I had maybe a little bit of a green drink or something. And after we were done with a couple of important appointments, we stopped to grab some lunch. And the lunch was at a little restaurant, Flanagan's or something, and got a hamburger, normal hamburger that I would ordinarily eat, but I found myself stuffed just about halfway through. And I'm really surprised about that. Really surprised. And in fact, I had to just take the bun off because I couldn't eat the bun. So I was already at my limit. So that had to go if I was just going to get down the rest of the burger. It was still pretty good, by the way. Now I'm a carnivore, so that just in case you hadn't figured that out. So for those of you who are not, you'll still find that that your brain will get the message that you've had enough to eat earlier in the process, and that's what you're dealing with that. So it's a great product, and even for some people who are not losing the kind of weight that they imagine that they would lose, the health benefits is off the Richter scale. Because remember, Ozempic and Mounjaro were not produced as weight loss products. They were all about for the A1C and diabetics. So that just gives you a hint at the potential for benefits to a person. And again, no side effects, all designed to work synergistically with all of the others of Dr. Prasad's formulas. So each one of these products that you'll see as I kind of page through, there's a story behind every one of them. And understand something, they are all very unique. They're not the same that you see on any shelf in any store, any place. They're not the same. They're all very specifically formulated by Dr. Kedar Prasad. This one, for example, is patented. There's nothing like this one in the world. Nowhere can you get this collagen peptide this way. You can go to the store and find collagen peptides by the dozen. I mean, there's walls full of collagen peptide, but not a one of them does what this one does. It has the hyaluronic acid, and it also has enzyme inhibitors, which means you keep what you make. And you may not understand that right now, but understand something. Most people are taking collagen and losing it as fast as they make it. That's called aging. Most are losing it as fast as they make it. This one, you keep what you make. So, and Dr. Prasad have added the enzyme inhibitors. That's the difference between his formula and everybody else's. Now, this particular bundle here is called the Core 4. This is what Dr. Prasad says really is just the foundation for good health right here, these 4 products. And I have to agree with him. So, but if you wanted to go and find all the ingredients that's in these packages, I would dare say it will cost you probably over $1,000. I haven't done the actual research on it, but if you just were to buy the boxes that you see right there, and by the way, if you got the ingredients for $1,000, you still have to figure out how much of each one to take. You start to figure out how much of each one of them you have to take in order to get the benefits. Well, Dr. Prasad has done all the research there and put all the formulas together in the right amounts from the right sources in the right form. That's it. So if you wanted to buy these by itself, it will cost $310, $15 to get those 4 items. That's just buying it as a one-time purchase. If you decide to become, a preferred customer, like me, for example, if I was to buy those, I get the wholesale price. And my wholesale price is about $250. So that's a pretty good discount. But Engage Global, the manufacturer of the product, the same David Nemelko who partnered with Dr. Prasad, they subsidized this. And do you know they knocked off another $50 off that price? Because they really want people to try it. They really want to put it within reach of everybody to be able to get this product. And for every product after that, if a person wanted to say add on the brain boost to this, do you know that they'll give them $10 off the wholesale price of the brain boost? And then if a person wants to try the sleep boost, do you know they'll give them $15 off the second one? If they want to try the CBD boost, they'll give $20 off that. And everything after that, they'll give $20 off each of those products. That's below the wholesale price because they want people to get to try these products and see for themselves the benefits that they have. So the company is really amazing when it comes to wanting to get this out there and to give you and me a chance at feeling better. So, but you can go through this brochure very slowly and see for yourself all the details behind it, what's in it, do the research on it, Google everything in there that you want. You can AI, you can do whatever you want. And all you're going to find out is that every single one of these is phenomenal. Phenomenal. Every one of them. And I've gone through it many times. And I can tell you that I know this for a fact now. It's no longer a guess for me. But the one little science I want to tell you about, this is about as much science as I'm going to tell you tonight, is this screen right here. And sorry if you don't like seeing actual organ tissue, but that's what you're looking at now. But what you're seeing on the screen belong to two rabbits. And before you start feeling sad about the rabbits, just know this: they both had really, really good last meals. Their meals were just phenomenal. They ate really, really well. They got their favorite meals just before they had a lethal dose of radiation. The one on the left only had his favorite meal. The one on the right had his favorite meal, but it was laced with Dr. Prasad's formulas. Now, those are both from the same organ. They're both lung tissue, and they're both originally looked like the one on the right. The one on the left looks more like a liver now, like it's been fried. But for some reason, the one on the right was protected. So just by consuming Dr. Prasad's formula, that's what's happened to the organs on the inside. Now, I did tell you it was a lethal dose, so it's not like he was going to be invincible. But think of the level of protection that was taking place inside that animal's body. Which would you prefer? If you're being exposed to high doses of radiation, what kind of protection would you like to have? And whether we're aware of it or not, we're all being slammed with high doses of radiation right now. It's called 5G. We're all being exposed to it. So little by little, we're all frying. We're all cooking from the inside out. In fact, right now, they have said that the cell phones of today are 700 times more powerful than the original cell phones. And those things are like sitting on top of microwaves, big old things like microwaves. But even though the ones we have now are nicer, fancier, the amount of radiation is 700 times more than the original. So that's why Dr. Prasad came up with the EMF formula, was to give us the extra protection. Remember, he was the world's first radiation biology PhD. So he understands how to protect the body from radiation. In fact, this clinical trial right here, the third one down from the top, it proved that after 72 hours, well, 24 hours, I think it was like 80 or 90% DNA repair after exposure to radiation. And in 72 hours, it was almost 100%. So if you're going in for a CAT scan or MRI or x-rays, make sure you take microdaily before and microdaily after, if you want to make sure that your internal organs are not being exposed and being damaged in some way. This is the list of patents that Dr. Prasad's products have been awarded. So this shows you that his products are not just the same old, same old. They are unique. They are unique. Look on the right side of the right column, second one from the top, multiple antioxidant, optimal health, Veterans Ultimate Complete formulation, optimal health. That word optimal health, those two words, optimal health, that's amazing. So he had the nerve to walk into the US Patent Office and said, my formula will provide optimal health for a person. And they awarded the patent. That's amazing to me. But the one that really is, for me, my heartthrob, is in the first column, second from the bottom, first one from the bottom, not the bottom one, but the next one up. It says micronutrients formulations for treatment of diabetes mellitus. And I had never seen any nutritional supplement with the word treatment in the title for diabetes. I never saw that before. And that's what got my attention. I knew about some very good products when Jeff Ashby came my way, but nothing had that effect. And I've seen now over the years that that's not just, they didn't just give that to that product. It had that ability. Now, keep in mind, once again, as I said before, we're not allowed to give you the impression that these products will treat or cure any disease. So that's not what we're saying. I'm just letting you know that those titles were given. These are the patents that this product has. And that's how come they're as unique as they are. Okay. So that's a little bit of the background. That's a little bit of the story about the products themselves and how phenomenal they are. I do want to share maybe one more story with you. This is one that relates to cancer. And please keep in mind, testimonies are purely anecdotal. What happens to one person may or may not happen to you. So we're not trying to make any claims that these products can treat, cure, or heal in any way. But this is an amazing story that took place, a couple stories that took place centered around cancer. And you may find them to be interesting. Now, I may have to fast forward to get directly to the story that I want to share with you. So just kind of bear with me, because I don't think this has been clipped out exactly. So for the record, folks, today is December the 3rd, 2020. That
I told him and his wife meals.
So
and do a couple packs of hydro
right here that's been infected by cancer. So if anyone is uncomfortable with that, now would be the time for you to maybe step away from your screen if you don't want to see this case. So just to let you know. But again, remember, folks, testimonials are purely anecdotal. What happens to one person may or may not happen to you. Beth, are you with us now? Let's see. We have to can somebody give Beth the ability to invite Beth? There
he was going to get 33. Yes, around August 2nd, his wife came to me. She had just learned about this product.
August 2nd, this year, 2023.
Yes, so there was no time for them to get shipments. So she came and picked up product at the house, and he was going to get treatment. He was going to get 33 rounds of radiation. It was under his eye. So I told them to take the 12 capsules twice a day, along with the omega-3 probiotic, and to do digestive enzymes before his meals, and do a couple packs of hydro during the day. And he faithfully did this. He did it every single day. He had his last treatment September 26th, around there. And we physically saw him when we had our Super Saturday in Charlotte. And the pictures that you have, I took a picture close up of his face. You can't even see the scar. So that was within 90 days of 33 rounds of radiation, plus doing the protocol that was given to him that I told him and his wife to do. But the biggest thing that he did, he listened, he did it, and he got the results. And I guess you're getting ready to show it. Yeah.
Was he taking the protocol during treatment as well?
He started it right when he started treatment.
First treatment.
That's when they got it. So
Yeah.
he wasn't doing it way ahead of time. He just learned of the product.
Sure.
They started maybe 2 days before he started treatment. He had 33 rounds of radiation.
That's amazing.
Within what is it, about 8 weeks maybe? I don't know, something like that.
Yeah.
And the thing about it is he had no downtime. He was not sick at all, and his energy never left him.
See, that's what the experimental data I was talking to you, at least in one example here, is confirmed. That if you take during the time, you get a maximum benefit of both. You have cancer, you don't have side effects. You can see that he has still all the hair, that he has a beard and everything else, never lost one. And as you mentioned, Jonathan, that during treatment, almost everybody loses hair. Temporarily, but it loses hair. But in this case, you can see that that high dose of antioxidant not only enhances the effect of radiation, but also protect the normal tissue. And in this case, is also trying to heal it faster once they get damaged.
And to give him a shout out, because he is a Marine, he's in the military, and he's also gone through a blood disorder for many, many years. So this is just amazing. And he is 72 years old. So he, you know, he kind of had all the odds against him, but, you know, he believes in the Lord. And then also, you know, he has this. So, hey, what can we say? Thank you, Dr. Prasad. From them to us, we really appreciate your work and your lifetime commitment to helping.
Selectively get
Already done.
effect. And
So that's one example there.
That the body needed.
I'm just trying to get you
activation is
to
very
one more
important
story.
to produce. I did not develop.
All right,
And
great.
in fact, let me.
I'm hoping that that we have it here.
Well, I needed to get it where my gallbladder used to be.
Okay.
And that's
Well,
where
apparently I
know I'm
don't
gonna
have it,
make-
but anyway,
in
the other
1
stories
month,
are
only-
outstanding, as you can see. That's just one example. We had another example of someone who had cancer on the bottom of their foot, and it healed up in about a month. Also, same kind of thing. So this is not normal. This is not normal. Something is unusual. When the body's given all of the nutrients that it needs, it knows what to do with it. And that's the whole point that this illustrates for us. Okay. So if you want to try some of the products, you just get back with the person who invited you here, and they will help you set up an account. And that's the best way to get it, is to have your own wholesale account with the company, Engage Global, and start taking it on a regular basis. Some of the folks who were taking the products were taking the normal standard dose, but I can tell you that the standard dose may be enough for most people, but for those of us who are a little bit older, we need to take a little bit more. And I've been taking at least double dose myself for a long time. I've had no chronic problems, but the only problem that I do have is my left knee learned how to talk and my right toe learned how to talk. If I don't take the right amount, they talk to me, and my back too. Same thing. I don't know how that happens, but they acquire the ability to speak when I don't take the right amount. So I've learned what my amount is, and what keeps me from hearing the noise from 3 different parts of my body. So if that's your situation, then don't blame the product, for not working. Simply take the right amount, and you'll see that there's a difference. All right, so take a little extra. All right, so let's see if there's any questions before we transition back to Delores. And if someone would like to share their story too, if you're taking a product and you'd like to share your story, feel free to do that also. But we're open for any questions that you have right now. And you'll have to raise your digital hand in order for me to be able to see it. I can see some hands on the screen, but not all. Okay, well, good. There's no questions. So here's what you do. This coming Sunday, we're doing a presentation where I'm interviewing Dr. Prasad.
Got a question?
A question came up? Go ahead. Oh, there it is, Winsome.
Yeah, hello, good evening, everybody.
Good evening.
So, hi, I had a question. I put the question in the chat, but I don't think you saw it. It's okay, I can say it. I've been going to the doctors for the past 4 months, and with something stuck in my throat, I keep telling them I can't swallow properly. And then they keep telling me they can't find anything. Long story, they now told me it's a nodule on the thyroid. And I do have the person who recommended me to come. So I was just curious about the products and looking forward to taking them, actually. So
okay. How much do they recommend that you take?
I think I'm the red box. I just saw the box, the color, and I think I'm the advanced one.
Okay, very good. Very good. May I suggest that if it is a nodule and you're not going to do a biopsy or anything on it to see?
No, they didn't recommend the biopsy. I thought they would have done the biopsy, but they just said to me it's benign, and I don't know how they know it's benign without doing the biopsy.
Right. Right. Understood. Understood.
Yeah.
But considering the fact that it's an abnormal growth, that tells you something, right?
Yes.
So an abnormal growth or abnormal cell translates into the same thing. And whether it's benign or malignant, it's still abnormal growth. An abnormal cell requires the uptake, it has to uptake glucose and glutamine. And we've had a lot of discussions on this with Dr. Prasad, and he's the one that has trained us on this. It has to uptake glucose and glutamine. You can block the uptake of glucose and glutamine in abnormal cells by taking high doses of antioxidant, like microdaily. Same way that Rick, with the cancer on his face,
Okay.
he didn't take a standard dose. A standard dose would not have made that kind of a difference for him. He took a therapeutic dose, triple the normal amount 3 times a day, and it was only for 90 days. And during the whole time, and you can't even tell that there was ever a problem. So I would suggest you consider going with the therapeutic dose for 90 days.
Yeah, I'm down for that. I'm on the my application was put in yesterday.
Okay, very good.
Yeah.
Very
Thank
good.
you.
So hit it hard and keep us posted. We look forward to hearing your story. Okay.
All right. Thank you so much.
No, thank you. Thank you for sharing. I do see a hand there, Silas.
Yes, I do have a question. My father is suffering from dementia, and the doctors have him on a blood thinner. And I was wondering, with taking the micro daily EMF, have anything that cause any side effect with the blood thinner?
Did you already start him on an EMF?
No.
Some of the doctors are a little concerned about the turmeric and the curcumin or something in there, and they say that it does have some thinning properties. That's what they say. So it might be better if he is taking a blood thinner to just maybe use the methylated form instead. So that would be just the one step down, so that it does not add a little bit further to it. But Dr. Prasad has made it clear that there's no contraindications, with any medications. Any of his formulas will not contraindicate. But if there is some concern, you just drop down to the next level down. Instead of the EMF, just go to the methylated. All right. So good question. Thank you very much. And by the way, I hope you put him on the entire core 4 plus extra microdaily. So don't give him the standard dose of microdaily. The collagen peptide is phenomenal because it blocks beta amyloids, and beta amyloids is what degrades a certain neuron in the brain that leads to dementia and leads to Alzheimer's. So the collagen peptide blocks that beta amyloid. The brain boost, literally, that's this thing here, has the ability to feed the stem cell. So even if a neuron has degraded, the stem cell is left behind. This is like food for those stem cells. It's food for it. It's feeding it. So I would highly recommend adding that to it, and the omega-3. The omega-3, phenomenal for the brain and phenomenal for the heart. So I would do all of those if the budget will allow for it, and to give him a fighting chance. Okay.
Thank you.
All right. No, thank you for your question. Appreciate that. And there's Delores. There's Delores. Okay, go ahead, Delores. No, that's not Delores on that screen. Hold on.
No, it's not.
You're right in the same spot there somehow. Okay, there we go.
Well, I was just going to come.
How did we lose you? Wait, we lost you there somehow, Delores.
Oh, okay. Can you hear me now?
Yes, go ahead.
Well, on the blood thinner and the EMF, my husband takes the EMF every day. He's on a blood thinner. Been on blood thinner for years. No, he hadn't had any problem.
There we go. And we're finding that to be the case in most cases. We have a gentleman right now up in Newark area. He's been taking massive amounts of EMF, but he's also been on Lovenox and Eliquis, and he's had no problems whatsoever. But you know, I have to pass on exactly what the technical, the technically correct answer is. You know, so but most people have no problems whatsoever, you know, with it. So, but thank you, Delores. Thank you for making that clear. That helps quite a bit. Okay. If there's no other question, while you're thinking about any last question, take a screenshot of this invitation for this coming Sunday. So you're more than welcome to make sure that you attend and invite anyone that you care about, because we're going to be talking about a National Stroke Awareness Month. And you're going to hear some amazing testimonials, some things that has happened. Someone who had a stroke and got microdaily within a week, someone who had a stroke that got microdaily within 2 years of having the stroke, and someone who had a stroke 10 years prior and started taking microdaily. All of them have something in common. They started taking microdaily, and they saw some interesting results that we'll share those with you this coming Sunday. So if you know anybody that could benefit from that kind of information, you want to invite them to that this coming Sunday, as you can see, at 5 o'clock Eastern Standard Time. And whoever invited you to this discussion, they of course can send you that invitation and text message or an email or WhatsApp or however you prefer to receive that. Okay. And if you know someone who would benefit from listening to this presentation tonight, all of my presentations are recorded on YouTube. So you can go to my YouTube channel, youtube.com/Jonathan Jones, and you could find this VIP presentation hosted by Delores Levette. And the recording will be right there in the live section. So it's being live streamed right now. And we do have one more presentation coming up at 9:30 Eastern Standard Time, which is 6:30 on the West Coast in California. So we have another presentation at 9:30 tonight. So if you know someone who needs to hear this information, then make sure you send them the invitation that you got for tonight. Send it to them, and they can come back to the 6:30 time on the West Coast in California time. Okay. So thank you all very much
Jonathan,
for joining.
This is Avis. I just have a quick
Avis.
question.
Hey, Avis.
Hi, Jonathan. Okay,
Hello,
question.
Avis.
Hi. You had mentioned that there was an electronic presentation or something that that you had a link to that.
Yes. That's very, very simple. This the same brochure that I was thumbing through.
Yes.
This entire brochure is in electronic form, and I can send you a link to that, and
Perfect.
it's yours. You can go right through all of this information. It's
Okay.
all available.
Thank you. Because
Okay.
I'd like to send that to. Yes, thank you.
Very good. Very good.
I appreciate it.
Happy to share that with you.
I'm sorry. May I get one as well, please?
Sure.
Can you put that link in the chat for us to grab it, or?
I probably can.
Thank you.
Where is it available online as a link? You know what? I don't know if I can send that as a direct link. Oh, well, maybe so. Hold on.
From your back office, you go to your.
Yeah, but it's harder to. That's probably the easiest way to do it. Let's just get that right out of the back office right now. Let's make this simple. Everyone's gonna want it. That is. It's an amazing piece of work. You know, they did put everything together, you know, right in that one spot, which does make it kind of amazing to have. And that's called Science. At least they used to call it Science. I don't know what they call it today. Let's see if that's what it is still. Science Asset Information. Science Brochure 2025. There we go. And copy link. Copy success. and chat to everyone. Meeting group chat. And there's your link.
Okay, I see it.
So everyone should be able to right click on that and it'll go straight. You should be able to download that same one that I just used.
Thank you.
And if not, you can always send me a text, and then we'll get the right one for you if for some reason that one does not behave the same way. But all I did was put it in full screen mode, and that's what made it fill out that way, and I could just thumb through it, very easily.
Okay, thank you so much.
You're very welcome. Thank you for joining. I'm so glad that you made it.
I am too.
Yeah,
Thank you.
absolutely wonderful.
Very informative. Very. People have been asking me for things, so I can send this to them. This will be great.
They'll keep it nice and simple for folks,
Simple.
and they can look it over and make sure that anytime you guys send things out, make sure that you find a way to attach your information to it, so that they know how to reach you and and contact you with any questions. And if you're anywhere on my team, just reach out to me, let me know, and we can schedule three-way calls with any of your friends.
Okay, perfect. Thank you.
Okay, you're quite welcome. So thank you all very much for joining us. And remember, if you have someone that that would need to benefit from this, they can hear the recording. It's on my YouTube channel, youtube.com/Jonathan Jones, or you can have them to come back to the next presentation that will be at 9:30 Eastern Standard Time, same as 6:30 over on the West Coast. So Delores, thank you very much, and feel free to conclude our meeting if you.
Okay, Jonathan, just want to thank you. First of all, thank you, Jonathan, for giving us all the information that you did this evening. I want to thank everybody for coming. And if there are any questions that I can help with, give me a call, and I'll call Jonathan. so we can make sure we have. But I do appreciate all that you do, Jonathan. You always. If I need you on a three-way call, if I need you to give a presentation, even if it's in person, you're willing to do it. I do appreciate it. And I do appreciate everybody for coming out. And don't forget Sundays. Every Sunday at 5 p.m., we are on Zoom. And it's always something that you can benefit from, always. It's so good always to have the formulator there too. Who knows the formulator of the products that they take? We can talk to Dr. Prasad on a weekly basis. So just thank you all for coming. Everybody have a good evening. And thank you, Jonathan.
Thank you. You guys have a good night. Thank you all for joining us.
Have a good evening. Good night.
Good night.
Thank you. Good night, everybody.
Good night.
Oh, no.